Hello everyone, welcome to Physio TV. So today we are having Dr. Shakeeb sir, who is our esteemed speaker and currently is consultant CBM India and consultant fellowship with mentally retarded. He has done his educational profile masters in disability rehabilitation and administration from Jawaharlal Nehru Technological University, Hyderabad, and he has done his PhD in Bangalore University 2024. So handing over the session to you, sir, and thank
Thank
you.
you. Thank you, Prathamesh, and hello, viewer of Physio Talk. It's my great pleasure to be speaking in front of you. While introducing me, Prathamesh may have forgot one thing. I am a physiotherapist basically, and this is what my identity is. And the reason I'm here is to talk to the physiotherapists about how physiotherapists play a very crucial role in the empowerment of people with intellectual, people with disabilities, people with all disabilities, and how they can make the world very inclusive. So before we go ahead, let us imagine a world where individuals, okay, any individual, regardless of his identity, as you know, we all have different identities. Like we have some are male, some are female, some are transgender. We have different. Apart from that, we have our religious, caste identities. Okay, and some of them have ability and disability. Okay, so imagine a world where regardless of disability or ability, every person fully participates and thrives with dignity. Okay. So this is the world where we can say the inclusion begin. Okay. Then you would be saying what physiotherapists have to do with it. This is where physiotherapy have a very important role to ensure that world is inclusive for all, and especially for people with disabilities. Um, Before we go ahead, I'll just brief you what is a disability. There was a time when disability was defined as there is a problem with somebody, there is a physical problem with somebody. Okay, and because of that, he or she may not be able to do certain activities which was according to his age and ability. All right. However, as the time passes, we have moved away from charity model. Okay, charity model used to say keep people with disability or something who need support, who always are dependent on somebody, who cannot do on their activities on their own, who requires lifelong care. Okay. However, when we have moved away in the right-based model and WHO very well defined, key disability is a mismatch between person health condition and their environment. So WHO says, World Health Organization says, the problem is not with the person with disability. It's an environment where the problem is. It's an environment which is not accepted. For example, you are going to a shopping mall. And generally these days, we see a shopping mall quite accessible. And there are, but however, you see a shopping mall, there is no escalator. And you are with your families, and some of your family members have uh, who are elderly and have knee pain. They decide that they will not enter the shopping mall because they cannot climb those stairs, considering there is no lift or escalator. So somehow your elderly family members are experiencing the forced disability because not because of them, because the shopping mall is not designed for them. And it is when we design for them, it doesn't mean that it's designed for them for exclusively. It is designed for them for everywhere. Okay. So this is where uh, disability as a context comes. The problem is not with the people with disabilities, it's with them. Many people with disabilities experience a lot of challenges in their day-to-day activities, which non-disabled don't face. Uh, since you are a physiotherapist, imagine you have a clinic, you open a clinic and it is on the first floor where there's no lift. How difficult it will be for a person with disability who experience a pain on regular basis, knee pain, back pain, neck pain, but because of your ignorance, he may not able to access your services. which he should have, which he should have been like anybody else. Okay, so this is where inclusion is. But when we talk about inclusion, it is just not about accessibility. It is more than that. Yeah. The real inclusion begins in our mindset. Okay. When we think about it, how do we ensure that everybody, irrespective of their ability, participate in it? Physiotherapy is definitely, we help as a physiotherapist, it is a primary responsibility to alleviate the pain. Okay. But apart from that, we also help in restoration of the movements. We also help to for rehabilitation of chronic conditions, whether it is neurological, musculoskeletal, or many other things. Okay. So, as a healthcare profession, we must take an pride that our works influence many of the people. Many, not only people, one we influence life, and not only for the individual, but the family around them also. So, how do we ensure that we play a very integral role in the inclusion of people with disability, and we can act as a pivot. First and foremost thing, I'll talk about before I discuss. I'll talk about the people with disabilities. Okay, and how do we address them? How do we use the word terminologies should we use? Okay, let us take an example. You see a person who has physical disability, and you have been taught in from our books, and that way we have been mentioning it differently, well, handicap. But what terminology should we use? Uh, a person with physical disability, we may term as lame, in Hindi, langra, lula, another thing. Okay, but his his disability or his or her disability does not define. It is he is a person first, then his disability. And trust me, nobody would want to be a disabled person. Okay, it's very disadvantage considering that how environment is inaccessible. So we must realize that people with disabilities, they never wanted to be. It's not a choice that you, but it is the circumstances that have led to disability. Right. So first and foremost thing, instead of having a sympathy, have empathy with them. Make sure you address them with their right terminology. Don't address them first of most thing, address by their name. Okay. Don't address anybody like because of his disability. Don't identify them because of their disability. Don't identify ki you have a person who comes for your therapy and say, oh, that wheelchair bound patient who comes to me, he is my patient. No, he or that person has a name. Maybe Ramesh, maybe Suresh, identify him. And definitely he is not bounded by wheelchair. He is liberated by wheelchair. Wheelchair is a part of his identity. It helps him to access, to navigate, and to access many things. All right. So definitely, when you see children, in case if you are helping children with neurodevelopmental disability or developmental disability, you don't say a child, a CP child, autistic child, a spastic child, a quadriplegic child. You you first tell his name, tell his or her name. He has a name, and that if of course he or that person has a disability, but beyond that he has a name. Okay, and definitely that disability cannot define he or so he's a child, for example, a child named Samir, who has cerebral palsy. How will you tell him? Child Samir, he's a 7-year-old child who has cerebral palsy. Okay. He is not a Samir is not a CP child. He is not a spastic child. He's a child with cerebral palsy. Okay. So these days there has been a lot of talk on sensitivity. How do we ensure that people with disabilities are addressed sensitively? Terminologies like handicap, spastic, quadriplegic, uh, blind, deaf and mute, deaf and dumb, autistic. We do not use these terminologies anymore. We identify the people, their disability. We tell them a child with cerebral palsy, a child with autism spectrum disorder, a child with hyperactivity disorder, a person with visual impairment, a person with speech and hearing impairment, a person having Parkinson. He is not a Parky patient that we generally say. He is not a stroke patient. He is a person first who has, and trust me, as I mentioned previously, no person would ever wanted to be have identified, would take as a pride he is a person with Parkinson or he is a person with stroke. Suppose they have this, these are the conditions, these are not disease itself, these are the conditions that they have encountered and they are part of their life, but they do not define them. Yeah. So this is what how that's why terminology should be very, very important. Second thing, what I feel, what I personally feel, and I really want other physiotherapists, the budding physiotherapists, or even the physiotherapists who have been there in this field for a very long time, is about empathy to the parents and caregivers. If you notice, parents and caregivers, they would never have wanted their children to be children having disability. No parent would ever. Okay. And no parent did purposely their child should be disabled. So when we speak to them, when we take do assessment and evaluate, we take their history. We must have a little empathy to it. Okay. The challenges that they have come all the way to come to your clinic, to come to your rehabilitation center. Okay. And many of the time you would have noticed, majority of the time the caregivers are female, the mothers. Okay. You have no idea how difficult it must be, for how stressful it must be for being a parent to a child with disability. Okay. Sometimes if you notice in the society, society relatives blame their parents, especially the mothers, okay, because of you, your son or daughter is like, which is very wrong and which is not scientifically or other way is also not true. Okay, but when they come, they may be on a level, a high level of stress. Okay? So during taking evaluation, during taking history, please be gentle. Okay, okay, and as you know, in majority of our Indian families, uh, mothers are just not for caregiver for their children with disabilities. They are caregiver. They ensure that they do all the household activities, go for work, and then also additionally take care of the children who have this particular who have disability. Okay, so that time you have to be very, very you have to be very, very sensitive about this. Many of the parents, if you see parents with parents having children with disabilities, considering and children who are on high support need, they have to, one of the parent have to leave the job. Even they like that job, they have to leave the job. And in most of the cases, it is the mother who have to leave the job for ensuring that we give sufficient care for their child with disability. So at this time, it is very important that you take the history assessment very empathetically. I also ask to refrain from expressing sympathy. Okay, so sympathy will not help you. Empathy will help. Understand their challenges, how difficult it is. Okay, if you see a parent, if a child mother has come, ensure that as much as possible, give them a better, a higher priority to address them, considering that the role that the challenges that they face. Okay, so these things should be there. Third thing is stop blaming them. Okay. As I mentioned earlier, nobody would have wanted to. Many of the time you would have seen consanguineous marriages among many. It happens in across all the in the Indian population. You see a large number of people have consanguineous marriage. Okay, so you cannot blame their consanguineous marriage. Of course, I'm not saying consanguineous marriage is not a critical one. It has an effect on disability and is one of the determinant of disability. But marriages are not the choices that many of individuals have. In India, majority of the marriages are in the hand of their families, where people don't have choices, and what parents decide, they do it. Okay, so you cannot make them blame for the consanguineous marriage or their parenting, or they are not able to give attention to them for their child is. So please stop blaming it. Okay, if there's anything to be blamed, okay, it is the environment. Okay, a child is not able to access therapies. Okay, because the cost of therapies is high. Okay, or because the cost, or it is not accessible. Okay, or it is not available at the easiest place. So it is not the parents who need to be blamed. Parents, I have seen in many, in almost all cases, whatever they could do for their children, they do it. Okay. So here you have to make sure, as a person who is very sensitive, as a physiotherapist who inclusive, you have to understand their challenges and stop blaming them. Okay. Third thing is, we as a physiotherapist, we can be more inclusive if we refer them also, where you feel key that can help. For example, a child with cerebral palsy, of course, but because of your intervention, the spasticity may come down, his tone may increase, his ability to ability to stand up, ability to walk will improve. But beyond that, he also needs something. He needs education. He needs access to vocational training. He or she needs access to other therapeutic services like speech therapy. Please do not hesitate it. And just do not refer. Tell them which are available. Where are they available? Okay. So this is how you can make it inclusive.